Thank you for having me here today. As mentioned, I'm a clinical and research social worker. I have been working in autism for about 10 years, and I entered the forensic system as a worker in 2012. And so I started working in the forensic system already with a bias of wondering how the forensic system works for people on the autism spectrum and where some gaps might be and what are some things we can do to improve this system. So some of the learning objectives for today. So I'd like to share with you some of the research that is out there already, the research outcomes that have been shown. I want to look at some risk and protective factors for individuals with autism before they come into the forensic system and then when they do come into the forensic system. As well, I'd like to highlight some practice complexities and some of the gaps and challenges that I think that we could work on to enhance these services. The information that I'm sharing today is based on my clinical experience as well as my research in this area. So there is actually references that go with everything that I'm talking about here. So I'm happy to provide that afterwards if anybody's interested in having a look at a list of about 100 references. Okay. So I'll tell you a little bit about forensic healthcare. Forensic healthcare falls under the umbrella of mental health care, and it's a service for individuals who have mental health challenges that end up in contact with the justice system. So this is typically the criminal justice system. In Canada, we provide consultation services, assessment services, and outpatient and inpatient supports as part of our forensic healthcare. These supports are governed provincially by provincial review boards who are then under the umbrella of the Criminal Code of Canada as well as the Mental Health Act. So that is determining treatment plans and how the services are run. Some information about inpatient programming across Canada. There's 25 inpatient programs across the country with about 1,500 inpatient beds for individuals and predominantly a significant number of individuals in the forensic system, inpatient and outpatient. Most of them are identifying as male. So I just thought it would be good to get a little bit of a basis of what we're talking about here. So at this point, there has been some research and clinical attention looking at intellectual and developmental disabilities within the forensic system, but research specifically looking at autism is quite limited and in fact hasn't yet been conducted in the Canadian context. So most of the research most of these outcomes are coming from the UK or Australia right now, some in the States, but nothing yet has been done in Canada. And we actually don't know how many individuals with autism are in the forensic system right now. The prevalence studies, or studies that have looked at prevalence, are very limited. And across those few studies, the numbers are all over the place. And so there's a number of reasons why that could be happening, which some of them I will draw your attention to today. But it's important to know that we actually don't really know what's going on. But what we do know, and what has been shown across several studies from 1944 until now, is that autism in itself does not increase risk for engagement in criminal behaviors. I think that's really important to note. While I think that this area is something that is important for us to look at and work on improving practices, it's not because autism increases risk. So I just really want to make sure that that's quite clear.